Good afternoon, Stroke Lawrence. My name is Mihiraa. Let's start the warm-up session. Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
What is your career goal after reaching your dream destination?
Right now I do not have any clear management goals. I am very interested in learning about management and leadership, and would be interested in any committees that I could participate in and learn. I have lots of ideas and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
What are the qualities that a nurse should possess?
Of course, a nurse should possess a variety of qualities. First of all, she should possess excellent communication skills, which help them not only to gather clinical data but also to maintain an effective relationship with other team members. Secondly, problem-solving and critical thinking skills are essential for nurses to deal with emergencies and difficult situations. Other qualities such as punctuality, dedication, honesty, and competency are also pivotal for nurses.
What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are very essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I like to give to future nurses.
Your preparation time is over. You can now start your role play.
Good morning, Mihiraa. I understand you've been experiencing some discomfort with swelling in your arms and legs. I'm Stroke Lawrence, one of the nurses on duty, and I've come to perform some routine clinical observations. This involves checking your weight, heart rate, and blood pressure, just to keep a close eye on how you're doing. We do this regularly for all our patients, especially those with conditions like yours, to track their progress and ensure they're responding well to treatment. It also helps us identify any potential changes early on. How are you feeling this morning?
Oh, hello, nurse. Honestly, I feel quite uncomfortable. My legs are so heavy and swollen, it's difficult to move around. I'm also a bit worried about what all this means. I haven't been sleeping well because of the discomfort.
I understand your concern, Mihiraa, and it's perfectly normal to feel this way, especially when you're not getting proper rest. It's good that you've mentioned the difficulty moving around and the impact on your sleep. These are important details for us. Now, let me explain what we're going to do to help reduce the swelling you're experiencing. We'll be using diuretics, which are medications that help your body eliminate excess salt and water through increased urination. Think of it as helping your kidneys flush out the extra fluid that's causing the swelling. This will help reduce the fluid buildup and hopefully make you much more comfortable. The next steps will involve inserting a small tube called a cannula into a vein, usually in your arm. This is a quick and relatively painless procedure. Through this cannula, we will administer the diuretics intravenously. We'll then closely monitor your progress, checking your urine output and the reduction in swelling, to see how you respond to the treatment. We will also monitor your electrolyte levels regularly. I hope it is clear to you.
Intravenous? Is that really necessary? I'm not very keen on needles. I've had bad experiences in the past.
I appreciate your apprehension, Mihiraa. Many people feel that way about needles, and it's completely understandable, especially with past experiences. Let me explain why we're choosing to administer the diuretics intravenously at this stage. Given the severity of the swelling you're experiencing, we need a faster and more effective response than we would get with oral medication. With oral medication, it has to go through your digestive system before it can be absorbed into your bloodstream. Intravenous administration ensures the medication enters your bloodstream directly, allowing it to work much more quickly and efficiently, targeting the excess fluid immediately. We want to get the swelling down as soon as possible to make you more comfortable and improve your mobility. Once your condition improves and the swelling has significantly reduced and you are stable, we will switch you to oral medication. The decision to switch will depend on several factors, including your overall health, how well you respond to the intravenous treatment, and your ability to tolerate oral medications. We'll discuss this further with the doctor, and you'll be kept fully informed of the plan.
That makes sense, I suppose. But will there be any side effects from these medications? I've heard they can cause dizziness and other problems.
That's a very good question, Mihiraa. It's important to be aware of potential side effects. Like all medications, diuretics can have some side effects, although not everyone experiences them. Some people might experience dizziness, as you mentioned, or perhaps some lightheadedness, especially when standing up quickly. This is often due to the change in fluid balance. That's why we encourage you to get up slowly. We'll be monitoring you closely for any of these effects. Before you are discharged, we will conduct some further tests, including blood tests. These tests are essential to monitor for any potential side effects of the diuretics, such as changes in your potassium and sodium levels. These are important electrolytes that play a crucial role in many bodily functions, including muscle and nerve function. We want to ensure everything is balanced and that you are safe to go home. We'll also be monitoring your kidney function. Do you have any other questions at this point?
No, I think I understand. I'm just hoping to get out of here soon. I miss being at home.
I understand completely, Mihiraa. We want that for you too. We know being in the hospital can be disruptive. We'll be monitoring you closely, checking your fluid balance, blood pressure, and the reduction in the edema. We'll also be looking for minimal or no side effects from the medication. We'll discharge you as soon as it's practically safe and appropriate to do so, once we're confident that the swelling is under control and your electrolyte levels are stable. We'll keep you updated on your progress every step of the way. Our priority is your well-being and getting you back home as soon as possible. Now, would it be alright if I begin with your clinical observations?
Yes, that's fine. Go ahead.
Thank you for your consent, Mihiraa.